Are you tired of living with constant knee pain and worried about having to go through a knee replacement surgery? Are you looking for more natural alternatives that can help with your knee pain and help you get back to function without going through surgery? If so, then this video is for you. Hi, I'm Dr. Jess Sally with Regenexx Pittsburgh, your Southwestern PA's premier provider of interventional orthopedics and orthobiologic injections. Get ready to learn about groundbreaking alternatives that are helping people avoid knee surgery and get back to function without having to step foot in the operating room. The number one question people have is it possible to actually avoid knee replacement surgery? First, it's helpful to understand that there are many different types of knee surgeries. There are arthroscopic surgeries or clean out surgeries where they may go in and remove some of the arthritic change. There are meniscus surgeries where they may go in and repair or even cut out areas of meniscus that are torn. And there's also replacing the entire joint overall. More minimally invasive knee surgeries may give people relief for a short period of time, but more often than not, patients are experiencing return of pain symptoms, and sometimes their arthritis even gets worse. Plus, there are also increased risks with knee surgery, such as infection, scarring, loss of motion, extended rehabilitation times, and extended time off of work or away from your normal life activities. So is it possible to avoid these knee replacement surgeries or other knee surgeries? The short answer is yes. Ultimately, it may depend on how severe your knee pain or arthritis actually is. There are several conservative treatments that you can utilize that can help with reducing knee pain and also help with impacting improvement in function and just making you overall stronger and more fit. Things like losing weight or going through some additional physical therapy to help with improving muscle strength or mobility can be very helpful for reducing pain symptoms and helping with daily function. Also, maintaining a baseline healthy diet can help with actually reducing inflammation in the body as a whole, and that can help with reducing pain from arthritis all throughout the body system. So what are some of the procedural alternatives for knee replacement surgery? Here at Regenexx Pittsburgh, we pride ourselves on providing patients with procedures that not only don't involve surgery, but are also very minimally invasive and help people with reduced rehabilitation times and getting back to life and getting out of pain faster. The main treatment that we utilize here is called our Regenexx SD procedure. This procedure involves utilizing your own bone marrow concentrate that contains your live stem cells to inject these into the knee and into the bone structure to help with reducing pain and improving function. Recent studies have shown that these types of procedures can actually help with improving pain symptoms and reducing patients' need for surgery for up to 15 years after the procedures. Not only are these procedures helpful for problems within the joint itself, but they're also helpful for improving pain symptoms that stem from other parts of the joint, such as tendons, ligaments, or other muscle structures that can also contribute to pain and mobility issues. These procedures are also helpful for meniscus issues and can help people to avoid more minimally invasive surgeries that cut out meniscus tissue and can actually cause worsening arthritis over time. Another type of treatment that we utilize is something called Regenexx SCP, which utilizes platelets from your blood that help with improving inflammation in the knee and can help with also treating things like ligament tears, muscle tears, or tendon tears that may contribute to pain and limit function in the knee as well. You may find this commonly referred to as PRP or platelet-rich plasma in the community. The big difference with Regenexx is that we can concentrate our platelet injections much higher than most other facilities and other practices, and we can utilize those higher concentrations to better treat the joint and the structures within the joint. We also pride ourselves on a comprehensive evaluation, so we know that it's not a one-size-fits-all treatment for everybody, and we're actually treating the problems that are contributing to your pain all throughout the knee. So is it possible for everyone to undergo these procedures? If you have pain in the joint or you have pain symptoms that just won't seem to go away, then it's likely that we have a treatment option that's right for you. These treatments have helped multiple different people with multiple different levels of arthritis and all sorts of different injuries within the joint to get better and get back to the life that they want to enjoy. If you would like additional information on these treatments, then visit our website and fill out a candidacy form to see if it's a good option for you. As soon as we get your form, we'll send you an email to get you some additional information right away and hopefully schedule you to get back on track with your health and reducing your pain. When it comes to knee pain and avoiding surgery, knowledge is power. It's good to explore more conservative alternatives such as diet, weight loss, or even exercise as possible options to help with reducing pain and improving mobility. If those types of conservative measures haven't worked well for you, please reach out to us to discuss our Regenexx procedures, and it's very likely that we have an option that will be right for you. Don't let knee pain hold you back today. Take proactive steps to help give you a healthier tomorrow. Stay tuned for our next video when we'll be talking a little bit more about platelet-rich plasma and recovery time that follows those procedures. Hope to see you then.